So I'm here in Melbourne, Australia, doing a seminar, and I've met up with my old friend Ron Guba. And hi, Ron, how are you doing?
Good. Good to see you, Robert.
What about cancers? Are you seeing any interesting developments in that area?
I think it's great. If you would have seen, the research in limonene and some of the earlier work from Elson on a whole number of common essential oil compounds, from pyrolyl alcohol to geraniol, eugenol, etc. Obviously, attempting to treat cancer, as some multi-level marketing companies claim to do. I started with skin cancers as the simplest place to start. So I've done a small study with 5 people now. 4 of them were basal cell carcinomas, quite small. In this case, I used a combination of orange oil, put in some sandalwood, which has some properties. What else? Frankincense. I think there might have been one more oil, but at a high concentration, 50% in an ointment. The basal cell carcinomas, quite small, all cleared up. It took 4 to 6 weeks to clear. And one of the attendees today had a quite large solar keratosis, and so she began using the formula that I had written about, and that cleared up in 3.5 weeks. So I'm quite impressed with that. I'd like to do more in my spare time as a research project.
Sounds very interesting. And I know you've done some work on wound healing. Is that still progressing? Are you still working in that area?
I've still been doing that ongoing since I last spoke at your lovely conference in 1997.
97, right.
So I continue to do that, mostly within the nursing home area, where people are using it on what are called bed sores, decubitus ulcers or pressure sores, and varicose or venous ulcers. And I continue to collect research, outcome, all case history stuff. And again, it works. That's the simplest thing to say.
Thanks, Ron. Nice
Okay.
to see you.